Hi, my name is Taylor. I'm a nursing student at Oakland University, and I'm just going to ask you a few questions about your health history, past and present health history.
Okay.
Okay, so your name is Mary Len Soto.
Yes.
What's your cell number?
586-565-0865.
Okay, and then your date of birth?
May 21st, 77.
First. Okay, and then what was your birthplace?
Philippines.
Okay, and then your age?
45.
Okay, and then which gender do you identify as?
Female.
Female. Marital status?
Married.
Married. Okay. Occupation?
Patient account representative.
Okay. And then race?
Asian.
Okay, and then what's the name of your employer?
McLaren.
Okay. And then what was your reason for coming in today?
Just for maybe annual checkup. History. Yeah.
All right. Can you just describe for me your general health? Do you feel like it's good, fair,
I'd say
poor?
it's fair.
Fair.
Mm-hmm.
Okay. Any childhood illnesses?
Maybe chicken pox. I'm not sure. That was when I was like 10.
Okay.
I think. I'm not sure.
Okay. Have you ever been in any accidents or any significant injuries?
Car accident in 2012.
Okay. Have you ever broken any bones?
They said lacerated liver, sprained on this hand, right hand, right over here. I got some stitches right here, eyelids, right eyelid, and I think that's it.
Okay.
Yeah.
That was all from the accident?
Yes.
Oh, wow.
Yeah.
Okay, and then what year was that accident? Do you remember?
2012.
Do you have any serious or chronic illnesses? Any history of that? No? Okay. Have you ever been hospitalized for anything?
Childbirth and from that accident.
Okay, have you ever had any operations?
For operations related to childbirth, I guess.
Okay.
Yeah, some stitches, but other than that, nothing.
Okay. And then how many pregnancies have you had?
5.
Okay. Then how many of those pregnancies were full term?
3.
3. And any preterm pregnancies?
No.
No.
Miscarriage, too.
Okay. Then, so you have 3 children?
Yes.
Okay. Okay, so all 3 were full term. What were the dates of each pregnancy? What were the birth dates of the children?
4/21/2006, 6/30/2008, 4/10/2012.
Okay, and then what was the gender of each child?
Female, female, male.
Okay. And then were those deliveries vaginal or do you have
Vaginal.
vaginal?
Yes.
Okay. Okay. Are all your vaccinations up to date?
Yes.
Yes. Okay. Do you remember what was the date of your last checkup? Or approximately how long ago that was?
I'd say about 3 years.
3 years. Okay.
Mm-hmm.
Do you have any allergies?
Seasonal, pollen, due to pollen.
Okay. And then what's your reaction when you are exposed to allergies? Sneezing?
Yes. Yeah.
All right. Do you take any current medications?
Vitamins? Supplement. Mm-hmm.
All right. Now I'm going to go over your family history a little bit. I'm going to name off some diseases or conditions and just let me know if there's any history of that in your family.
Okay.
Heart disease?
No.
High blood pressure?
Yes.
Okay. Which relatives?
Mother.
Okay.
Yeah.
What about stroke?
I don't know. I'm not sure.
Diabetes?
Yes, father and grandfather and aunties, father side.
Okay.
Yeah.
Any blood disorders in the family?
No.
No. Breast or ovarian cancers?
No. Oh, breast. Yeah, I think my grandfather's sister.
Okay.
Yeah.
Any cancer in the family?
Cancer, brain cancer, cousin, first cousin.
Sickle cell anemia?
No.
Arthritis?
I think my uncle, father side. I'm not sure.
Any allergies?
Family. That would include my children, right?
Mhm.
Or families. Yeah. My son.
Your son?
Yeah.
Asthma?
Yes, uncle.
Okay. Obesity?
Yes.
Okay.
Yeah. Me.
Alcoholism or drug addiction in the family?
Not actually. Maybe like alcohol consumption, but not alcoholism.
Okay.
Yeah. Mhm.
Okay. Any mental illnesses in the
No.
family? No. Suicide?
No.
Any seizure disorders?
No.
How about kidney disease?
Yes, father related to diabetes.
How about tuberculosis?
Um,
All right. Okay, have you experienced any recent weight gain or weight loss? Any sudden weight loss?
Well, weight gain since I got pregnant and that stayed there.
Okay.
I've been trying to lose some weight.
Okay.
Yeah.
Okay, let's see. Okay, do you have any weakness or fatigue?
uh, well, just the regular ones due to like being a mom.
Okay.
Yeah.
Understandable.
Yeah.
Are you having any fever, chills,
No.
night sweats?
No.
Nothing like that?
Mm-mm.
Do you have any history of skin disease, such as eczema, or
I
psoriasis?
think I had eczema when I was younger, maybe when I was like in my grade school years,
Okay.
but that was resolved.
Okay.
Mm-hmm.
Have you noticed any change of color in your skin?
No.
Have you noticed any change in any moles?
Moles? Not really.
No.
Yeah, no.
Any excessive dryness or any itchiness?
Well, dryness due to weather.
Okay.
Yeah.
Have you noticed any excessive bruising?
When I think when it's getting close to my period, that's when I get bruised.
Okay.
But after that, it would just go away.
Okay.
Mm-hmm.
Any rashes or lesions
No.
anywhere? No. Okay. Have you had any recent hair loss or any change in your hair you notice at all?
Gray.
Gray hair?
Gray hair.
Okay. Okay, how about your nails? Have you noticed any change in any shape, color,
No,
texture?
they're still the same texture.
Okay. What would you say is your amount of sun exposure? Are you in the sun a lot or not very often?
Not very often. I try to avoid the sun. So maybe like early in the morning around 8 for like 10-15 minutes while we wait for the bus. And in the afternoon, same time. Most of the time, I'm just inside the building.
Okay.
Mm-hmm.
Okay, do you use anything on your skin to protect yourself from the sun?
Just my face, sunscreen.
Sunscreen?
Yeah.
Okay, good.
Mm-hmm.
Okay, do you get any frequent headaches?
Yeah. I'd say maybe because of my eyes, maybe I would need change of prescription.
Oh, okay. Do you have any history of head injury?
No.
No. Do you get any dizziness or vertigo?
Maybe during my period because of the discharge.
Okay.
Yeah.
All right. Have you noticed anything different with your vision? Any difficulty seeing?
Uh,
Blurriness?
no. It's always been like this. It's just
Okay.
that the prescription just keep on rising.
Okay. Are you having any eye pain?
Not really, no.
No. Do you have any history of glaucoma or cataracts?
Not for myself. No.
Okay. I see you wear glasses. Do you
Mhm.
wear contacts ever or just
No.
glasses?
I tried, but it's uncomfortable.
Okay. Do you remember when your last vision check was?
It was 2 Fridays ago. It
Okay.
was the 30th, I think.
Okay. Did you get a glaucoma test when you were there?
Mm, well, they checked the pressure, but they didn't say it's for glaucoma.
Okay.
Mhm.
All right. Do you get frequent earaches or ear infections?
No,
You feel like your ears are ringing?
not really.
No? Okay. You experience any hearing loss at all?
No.
No? Okay. Do you have any exposure to excessive noise that might damage your hearing?
Not more than usual. It's just that when you listen to the music at home, but
Okay.
yeah.
All right. Do you get frequent colds?
Not recently.
Okay.
Mhm.
Do you get nosebleeds?
Sometimes when the weather is too hot, I get nosebleeds.
Okay. And you said you have seasonal allergies too.
Yes. Yes.
Do you get runny nose or stuffiness with your allergies?
Sometimes, yeah. Watery eyes, yeah.
Okay. Are you having any mouth pain?
Not right now. No.
Okay. Do you get a sore throat a lot?
No.
No. Any issues with your gums? Any bleeding or swelling?
No.
Any toothache?
Toothache, not recently. This has already been resolved.
Okay.
Yeah.
All right. Do you have any issues swallowing?
No.
No. Okay. All right. What do you do to take care of your teeth? Like, what's your daily routine?
I brush 2 to 3 times daily, floss, mouthwash, and I try to stay away from sugar.
Okay. Do you remember when your last dental checkup was?
I think first week of August this year, and I go twice a week. No, twice a year.
Twice a year?
Yeah, not a week.
Okay. With your neck, do you feel any neck pain? Any
Maybe in the
limitation?
morning when maybe because of the position, I feel some pain, but it goes away.
Okay. Do you feel like you can move your neck around okay?
Yeah.
Any limitations there?
No.
No. Okay. Do you notice any breast pain?
Breast pain, yeah, especially when it's getting closer to my period,
Period.
but
Okay.
it goes away.
Have you noticed any lumps, any nipple discharge,
No,
rash?
nothing like that.
Okay. Do you have any history of breast disease?
Not for myself, no.
For yourself? Okay. You've never had any procedures on your chest?
No.
Any surgeries?
Nope.
Okay. Do you perform breast self exams?
Sometimes,
Sometimes. Okay.
yeah.
Okay. When was the last time you've had a mammogram?
Never.
Never. All right. Do you have any history of lung disease such as asthma, emphysema,
No.
bronchitis,
No.
pneumonia?
I think I had bronchitis back in 2009.
All right. Do you get any chest pain?
Uh, no.
Any trouble breathing? Shortness of breath ever?
Only for overexertion, I think.
Okay.
The trouble breathing. Yeah. But
Okay.
yeah.
Okay. How much activity do you think it takes for you to become short of breath? Is it just heavy exercise or
Heavy
with walking?
exercise. Sprint walking would cause me that. Heavy lifting. Um, too much stair climbing, I guess. Yeah.
Okay.
Mhm.
All right. And then when was your last chest X-ray?
I never had one.
Never had one. Okay. All right. Do you have any history of heart disease?
No.
Okay. Heart palpitations?
Yes, when I'm anxious.
Okay. Um, do you feel like you have trouble breathing while laying down?
No.
Okay. Do you ever wake up in the middle of the night like short of breath?
No.
No. Okay. Um, any history of heart murmur?
No.
High blood pressure?
Yes.
Okay.
But it's not confirmed medically, I mean.
Okay.
Yeah. Just while in this class.
Okay. Any history of coronary artery disease or
No.
anemia? No. Okay. Have you ever had an ECG done?
No.
No. Okay. Any heart tests?
No.
Okay. All right. Do you feel any coldness or numbness or tingling in your extremities, like your fingers or your toes?
Some on the fingers. Maybe because it's related to the accident.
Okay. What do you feel?
Yeah.
Like
tingling.
numbness,
Tingling.
tingling?
Yeah.
Just in your fingers?
Yeah.
Okay. Do you get any swelling in your legs at all?
My legs? No.
Okay. Do you have any varicose veins?
Some spider veins over here, but very little. Yeah.
All right. So at work, does that involve a lot of sitting? Do you sit a
Yes.
lot? Okay.
Yeah, I use the computer 6 to 8 hours a day, but I try to walk like for 1 to 2 minutes on the hour.
Okay, so
Yeah.
you make sure to get up and move around
Yeah,
sometimes?
yeah.
Okay, that's good. All right. Okay, how would you say your appetite is? Do you feel like you have a good appetite?
Yes.
Okay. Any food intolerance? Is there anything that
Mint somehow makes me sneeze, but I
Mint?
wouldn't say I'm allergic to it.
Okay,
Too much salt also makes me sneeze.
salt?
Mm-hmm.
Do you ever get heartburn or indigestion?
Sometimes
Okay.
heartburn. Yeah, maybe because of, especially when I eat too much, I get something like here.
Okay. Are there any foods that you know of that give you any problems?
Heartburn. Spicy food, I would say.
Spicy.
Yeah.
Okay. All right. Do you have any history of abdominal disease? Any issues with your liver or gallbladder?
I got my gallbladder removed in, what was the date? I think that was 2016 or 17. I don't remember.
Okay. All right. How frequent do you have bowel movements?
Daily.
Daily? Okay.
Sometimes twice a day.
Sometimes twice. Okay. Do you have any issues with constipation or notice any different color in your stool?
No.
Okay. All right. Do you ever use any antacids or laxatives?
I think I used it once, but I don't remember when that was. A long
Okay.
time ago, yeah.
Okay, but you don't use them
No,
regularly?
no.
Okay. All right. Okay. Do you have any problems with urination? Do you feel like you urinate very frequently?
Uh, about maybe every 1 hour to 2 hours, I urinate in a good amount of urine, but nothing unusual.
Okay. Do you feel like it comes out easily? Do you have any?
Yeah,
Yeah.
yeah,
Okay. All right. Any incontinence?
no.
No. Okay. Do you have any issues of kidney disease, kidney
Kidney disease?
stones,
No,
urinary tract infections?
no.
Okay. All right. Okay. When was your first menstrual period?
When I was 11 or 12 years old,
Okay. And then when was your last period, if you can remember?
I'm having it right now. Yeah.
I'm sorry. um. All right. Do you have any pain with your periods? Any cramping?
Yes, before and during.
Before and during?
Cramping.
Okay. Do you take anything for that?
Tylenol if I couldn't take it anymore.
Okay. Do you remember when's the last time you had an appointment with your gynecologist?
5 years?
5 years.
Yeah.
Okay. Do you remember if you had a pap test? Pap smear?
I did with that appointment.
You did at that
Yeah,
appointment?
it was
Okay.
normal.
All right. Okay. Are you presently in a relationship involving sex?
Yes.
Okay. Do you have any pain during sex?
No.
No. Using any contraceptives?
What's this method? The natural method. Rhythm? Just that.
Okay. Okay. Do you have any history of STDs,
No.
STIs? Okay. Have any history of arthritis or gout?
No.
No. Okay. Do you feel in your joints any pain, any stiffness?
No.
Notice any swelling
Swelling? Maybe this.
in your hand?
Yeah. Because of that, I need to have this checked out.
Right. Do you notice any limitation of your any of your joints? Any problems moving around?
Not really. No.
Okay. Do you get any cramps or pain in your muscles?
Muscles? Just the abdominal related to my period.
Okay.
Yeah.
Any muscle weakness?
No.
Okay. Do you notice any problems with your coordination?
No.
No. Okay. Do you get any pain in your back? I know you said
Yeah.
you sit a lot at work. Do
Yeah.
you think that
Yeah.
causes some back pain?
Yes. You get back pain.
Okay. Then how much walking would you say you do per day?
Per day, I try to walk twice or thrice a week.
Okay.
About 30 to an hour per walk. Just regular walking.
Okay.
Yeah.
All right. Do you feel like you have any difficulty with your daily activities, such as grooming, feeding, dressing?
No.
Okay. All right. Do you have a history of any seizure disorders?
No.
Any stroke, fainting?
No.
All right. Do you have any issues with memory?
Memory? No.
No memory issues. Okay. Do you have any issues with nervousness, mood change, depression?
No depression, but I get nervous sometimes.
Okay.
Yeah.
What makes you nervous?
Well, health assessment.
Yeah. Okay.
Tests,
Sometimes
exams.
school gives you a little
school.
anxiety.
Yeah.
Okay.
Sometimes work.
Sometimes work? Okay.
Yeah.
All right. Do you have any history of mental illness
No.
at all? No. Okay. All right. Any excessive bruising?
Only when it's getting close to my period.
Okay. Remember you said
Yeah.
that. You ever had a blood transfusion?
No.
Okay. Any history of diabetes?
No.
Okay. And then you already said no to frequent urination.
Yes.
Okay. History of thyroid disease?
No.
Okay. Do you notice any intolerance to heat or cold?
No.
Okay. Any excessive sweating?
Sweating? No.
Okay. Any need for hormone therapy?
No.
Okay. All right. So, what was your highest level of education completed?
Bachelor's degree.
Bachelor's degree. Then, what was your degree in?
Computer science.
Okay. Do you feel like your financial status is adequate for your lifestyle,
Yes.
for health management? Yes. Okay. All right. Do you have a belief system? Are you religious?
Not religious, but I belong to religion. Baptist.
Baptist? Okay.
Mhm.
All right. Any self-care behaviors that you feel just help you feel good, help with your self-esteem?
Just being around with friends, I guess.
Okay.
Eating out with them, seeing a
Okay.
movie.
All right. Okay, for exercise, remember you said you like to go for walks 2 to 3 times a week.
Mm-hmm.
Okay. For you said half an hour to an hour each
Yeah.
time.
Yes.
All right. Any leisure activities? Anything that helps you wind down or relax?
Sleep.
Sleep?
Yeah.
Okay. All right. And then back to exercise. For exercising, is there anything you do like to warm up? Any stretches?
Not really. No, I
Okay.
just go right at it.
Okay.
Yeah.
All right. Can you remember what you've had to eat in the last 24 hours?
This morning I had a toast and tea. Last night, toast and ham.
Toast and ham?
Yeah. Sometimes we have pork, chicken, rice. Yeah. It's always like that.
Okay, yeah, so that's pretty typical. That's
Yeah.
usually how you eat. Okay.
Mhm.
Okay, who buys the food in your household?
I do. Sometimes my husband does too.
Okay. And who prepares the food?
Half of the time I do, but then half of the time I order in.
Okay.
Yeah.
Do you feel like your finances are adequate for
Yes.
food?
Mhm.
Okay. Who's there with you during meal times?
Everyone, my kids and my husband. Yeah.
Okay. How would you describe your role in your family?
I'm a mother, wife, nanny, maid.
Okay.
Mhm.
All right. How do you get along with your family, friends, coworkers,
I think
classmates?
I go well along with them.
Okay, you get along with everybody.
Yeah.
Okay. And then who is it that you get support from?
My husband,
All right. And then how much daily time do you spend alone, do you think?
not very much.
Is this pleasurable or isolating?
Well, it's being my kid, so I'd say
It's
it's
good.
pleasurable. Yeah.
Okay.
Mhm.
Okay, how would you describe your stress level right now?
Maybe fair.
Fair?
Mhm.
Do you feel like it's manageable?
Yeah, it's manageable.
Has there been any changes in the past year with your level of stress? Has it gotten
Well,
better, worse?
I'd say it's worse than last year because of the additional, school being
School.
added to my usual day.
More workload?
Yeah.
Okay, and then what do you do to help relieve stress for yourself?
I walk.
Okay.
I go to the mall. If I have time, see a movie.
Okay.
Yeah.
You like to shop?
Well, window shopping most of the time.
Okay.
Yeah.
You think these methods are helpful for you? You do a
Yes.
pretty good job?
Yep.
Okay. All right. Now, how frequently would you say you intake caffeine, such as coffee, tea, or
Well, I
hot?
just switched to green tea. Have quit caffeine for about 2 months now.
Okay.
Mhm.
How often do you drink tea?
Every morning,
Every morning?
and then maybe once or twice before nighttime, or before bedtime, I should say.
Okay. Do you smoke cigarettes?
No.
No. Have you ever?
I think I did back in high school. Just tried,
Okay.
but never really like.
Okay, it was never like a habit?
Yeah.
Okay.
Yeah.
Okay, how about alcohol? Do you drink alcohol?
No.
No? Okay. Have you ever? Has it ever been like a habit for you?
What, the drinking?
Mm-hmm.
I didn't even try drinking.
No? Okay.
No.
Any use of drugs? Just
No.
marijuana?
No.
Okay, how would you describe your housing and neighborhood?
Okay, right now we're living in an apartment.
Okay.
It's a close community, so I'd say it's safe.
Okay, do you have adequate heat and utilities where you
Yes.
live?
Yes.
Yes. Do you have access to transportation? Do you
I drive my own car.
You drive your car?
Mhm.
Okay. Do you know any of your neighbors?
Well, we've been there for like a couple of months. Yeah, I just
Okay.
know those are really next to us.
Okay, are they
But
nice?
not a lot. Yeah,
Nice
they're
neighbors?
nice so far.
Okay.
Yeah. Yeah.
All right. Are you involved in any community service?
No.
Do you have any hazards in the workplace or at home?
Workplace? No.
Do you use seatbelts?
Yes.
Do you travel to any other countries?
No.
Have you ever had military service in any other countries?
No.
No. Okay. So how do you feel safe at home? Do you feel threatened by any family members?
No.
All right. Have you ever been emotionally or physically abused
No.
by a partner or family member?
Nope.
Have you ever been hit, slapped, kicked, pushed, or shoved, or hurt by
No.
anyone? No. Has your partner ever forced you into sex?
No.
No. Are you afraid of your
No.
partner or anyone in your home?
No.
Okay. And then, how would you describe your job?
It's more of an office job. I just sit most of the time. Phone calls.
Okay.
Computer. That's it.
Do you work with any health hazards? Any chemicals?
No chemicals. No.
So, do you have any health problems that you think are related to your job? I know you said you have some back pain
Yeah,
sometimes.
some back pains. Yeah.
Anything else?
Maybe because of the computer use, that's why my eyes are getting worse.
Yeah.
Yeah.
Okay. Okay. And then, how would you define health?
Health is the absence of illness, basically. If you're
Okay.
not sick, you're healthy.
All right.
Yeah.
And then, what are your health concerns right now?
I'd like to lose some weight.
Okay.
And then maybe see the doctor to finally, know what's wrong with my blood pressure.
Okay.
Yeah.
Okay. What do you expect will happen to your health in the future?
I hope it gets better, not get worse.
And then, what are some of your health goals to help improve your health in the future?
Get more exercise,
Okay.
more alone time, eat healthy, less sugar.
Okay, and then last question. What are your expectations of nurses, doctors, your healthcare providers, what would you like to see from them?
I would like to hear from them the root cause as to why I'm having, right now, blood pressure,
Okay.
high blood pressure. Answers from them, basically. Tell me what's wrong.
Okay.
Mhm.
All right. Do you have any other questions for me?
No,
Any
I think that'll be
questions?
it.
Okay. All right. Well, then that's it for the interview. Thank you so much for your time.